Hey, my name is Dr. Sean Price, clinical coordinator here at The Fix, and in this video series we're talking about times or conditions where chiropractic alone may not resolve and may not get you the results that you want. We do see patients in our office who have been to previous chiropractors who have received chiropractic treatment. We've even seen patients in our office, I have to admit, that we've treated in the past when we weren't doing the kind of work that we're doing now, that I had seen back in the past that maybe didn't get the results that I could have achieved with them since I started doing this kind of work. So this is not a knock on other chiropractors at all. This is just a situation where there's something that could be going on beyond traditional chiropractic treatment. So what I'm saying is, if you've received chiropractic care and you did not get the results that you want, please don't discount chiropractic or your chiropractor. There could have been something else going on that made the case more complicated. You can go back to your chiropractor, get the adjustments, come to us. We can help you with these problems that we're talking about here and actually get the results that you were looking for. So in the last video we talked about brain function. This video I want to talk about metabolic disorders. Metabolic disorders are things like digestive disorders or thyroid disorders such as hypothyroidism or Hashimoto's, blood sugar handling disorders like diabetes, all kinds of different autoimmune disorders, all these different things that can be related to metabolic function. Because remember, we talked about the brain sends a signal to the body for the body to carry out function. Well, if as a chiropractor we remove that subluxation and the brain can get the signal to the body, but the body's unable to carry out the function, that could be because of a lack of metabolic status. The thyroid gland, the thyroid metabolic pathway, if it's not working properly, you can remove that subluxation, but you're not going to get the result that you're looking for because the body can't create the fuel to heal properly. If it's a B12 deficiency anemia or an iron deficiency anemia, and maybe you're not getting oxygen delivery to the cells, well, when the nerve flow gets to the cell but the oxygen's not there to provide the fuel for the healing, you may not get the healing. So metabolic disorders can cause chronic pain and can cause you not to hold your adjustments and can cause all kinds of different problems with your health. So what do you do about that? We use functional medicine. And I prefer the term functional nutrition, but functional medicine is the term that's out there and more commonly used. Basically what that is when you use labs, you run a lab, you decide what kind of a nutritional protocol needs to happen with that those labs, and then you design that nutritional protocol and you carry it out. Then in a period of 45 to 90 days, you rerun the labs and see how you're doing. Are you improving? Is it the same? Is it getting worse? And you can modify it based on labs. So functional medicine is objectively based lab value nutritional protocols, and it is extremely effective. And what it does is it allows the body to get back to a metabolic state where it can carry out the functions that it is meant to. So again, like we talked about in the last video, we have to make sure that the brain is functioning properly, so the signal that's getting to the body is the appropriate signal. We have to structurally make sure that you're clear because of chiropractic, but then metabolically we have to make sure that you are functionally sound and metabolically able to carry out the functions that your body's trying to carry out. We do that through functional medicine. We make sure the brain's functioning properly through brain-based therapy. All right, so this is another aspect of a complication that could make a case a little bit more than just a structural subluxation-based issue. All right, any questions, please feel free to post below. Feel free to subscribe to our YouTube channel so that you can get more of these videos in your inbox, and then also you can like us on Facebook. All right, let me know if you have any questions.